ahead and I'm going to go ahead and you want to go directly into the sorry the NLN case study. Should we do that?
Yeah, I'm okay.
Okay, let's see here. Let me go into okay. All right. Okay, so can you see my screen?
Yes.
Okay. All right. Can you shut this? So I'm going to go ahead and get started. So my thought with this, Lynn, was, you know, I mean, yes, it would be easier just to say, oh, we don't have another case study this week. However, that's 5 points and you guys need the 5 points. So we have to make it up somewhere. So I thought utilizing this case study from the NLN would be a good start, and it's not I don't think it's too difficult, and you have till Monday to do it. All right. Before I get started, did you have any questions, Lynn, that you wanted to ask first?
Not really, Miss Barb.
No. Okay. All right, well, I'll go ahead and get going. I don't know why I have this weird other Google Hangout thing here. Okay. Wait, that's not what I want. So stop me if you start, you know, you want to ask me something, okay?
Fine.
All right, so let's go ahead and start with, this is the introduction and it's going to be a monologue from the mom. Okay, let's see.
My name is Amber McAdam, and I'm a mom of 3. My husband Marshall and the kids and I live in the suburbs in our dream home, which we bought last year. We both work full-time. I'm an accountant and Marshall works for a construction company. We do okay financially. There's not a lot of money left at the end of the month, but we manage a trip with the kids maybe once or twice a year. And our kids are in a good daycare facility. Our son Jameson is almost 6 years old. We were so excited when we planned for a child, and I got pregnant right away. Jamie has always been so smart. He walked at 10 months and was speaking in sentences before he was 2. We spent a lot of time with him reading and playing. He is in kindergarten now, and he can read simple books. He's the only one in his class who can read already. My mom's a teacher, and she's so proud of him. We all are. He has a lot of friends in the neighborhood and in school. Stella is 4. She's a funny, active little girl. She's so helpful around the house, and she really helps with Damon. She goes to gymnastics class with her daycare class, and she's doing amazing. She gets along with everyone and is the best teacher's helper. She has a temper sometimes, but I like to think of it as being strong-willed. Good for her. Damon is 2.5 years old. He was a strong, healthy baby, my chubby 9-pound boy. He seemed like the other kids when he was born, although he never slept very much. He started out talking like they did. When he was a year old, he had about 10 words you could understand, and a lot more words when he was 18 months old. It seemed like he changed before he turned 2. He stopped talking as much, and some words he won't even say anymore. He can put puzzles together even better than Stella, but he doesn't like to do things with other kids. He can scream and have temper tantrums about silly things. The daycare teacher seems worried about him. She's known him since he was an infant. I'm a little worried. He also does some odd things my other kids never did, like rocking back and forth for long periods of time. Not talking, just sitting on the floor and rocking. Marshall has a hard time with the tantrums. Damon doesn't respond to his name or verbal commands. It can make you really mad. Is he not listening or just ignoring us? The other kids had their moments, but they never got so upset and hard to reach like Damon. Marshall was never crazy about the infant stage. He did more with the kids once they started walking and talking, but Damon seems to frustrate him, so he kind of avoids having to take care of him. It's not like it was with the other kids. And now Damon seems really sick. There's a few other kids at daycare with this stomach thing. He started vomiting 3 days ago, then diarrhea. I've been home from work with him the last 2 days. He's a really picky eater, but since yesterday, I can't get him to drink water or his favorite juice. I'm worried he's dehydrated. He's just been lying around. The rest of us are okay. I sent the kids to school and daycare this morning. They all ate dinner tonight, and I put the kids to bed at 7:30. When Damon wouldn't even stand up this evening, I knew he was really sick. I told my husband I was taking him to the ER. Marshall stayed home with the other kids, but I know he's worried too. I hope the ER staff can handle Damon's temper. Though he seems so sick now, I don't think he'll put up much of a fight. I wish I could explain to him what's going on.
Okay. So the idea is, Lynn, that now we would go over here to these questions. Do you see these?
Yes.
So so what are the family strengths that you got from? So we can do this a couple ways. I can walk you through how I see this assignment going, and then that way you can go back and listen to the monologue and kind of work through this a little more. Since you're the only one on here, you're not going to get very much help here. I think that's probably your best bet, so you have a little time to listen back to the mom. I mean, we can talk about, let's say, what are some of the family strengths? So as far as financial stability, it sounds like the dad is working, right?
Yes.
That they have money. Offhand, what are some current concerns that you have about Damon?
He has a temper.
That he has a temper. What do you think is going on with him?
The mom said he was repeating or like banging his head on the wall.
Yes. So I feel like I hear, so what do you think, Damon, what do you think Damon has, I should say?
Autism?
Yeah. I feel like I'm hearing someone talk. Do you hear someone else talk, or is that just, maybe it's just someone outside? So yeah, so so what are some concerns about him right now? Like what's going on with him right now?
He's very sick.
as far as physically. Yeah, it sounds like he's got the flu. And with a child like this, it's probably difficult to get him to take food when he's, you know, because it's hard to communicate with him, it sounds like. What, is there anything more that you want to know from her, from the mom? You don't?
I don't know, Mr.
Okay, that's all right. So as far as concerns, let's go back up there. Some concerns you would want to know what's going on with him exactly. What are the symptoms? Like, is he running a temperature? When did he start feeling sick? You know, kind of dig into more of that. As far as his behavior and his development, mom has said that everything started to change around his second birthday. So wanting to do a little more research on that. And then down at the some causes for what are the cause of your concerns? Well, now he's currently sick and it sounds like he's so dehydrated or has something going on that she couldn't even get him to stand up. That's concerning, right? For a child, that's very concerning. And the other part to this is that she has already shared that her other kids do not have this problem. So this is new for the family to try to deal with. Okay. So once you work through those questions, you can still see my screen, right?
Yes.
Once you work through those questions, I'm going to start here. This is the charting materials, okay? And I'll open these up and show you. Okay. Okay, let's see here. All right. So this is the emergency room triage nurse. This is 8 o'clock at night, 8:10 at night. And Damon McAdam has come, he's 2.5 years old and was brought to the ER from the mother. So this is an SBAR report, okay? So the background is that Damon McAdam has been ill for 3 days. The mother reports that it started with vomiting and progressed to vomiting and diarrhea up to 10 loose green stools today. She noticed that he's becoming lethargic. She has not checked his temperature. She said he exhibited some strange behavioral things and would not cooperate when she tried to take his temp. The last stool was an hour ago and his last void was over 12 hours ago. He's had all his immunizations. He is in daycare and a few of the children had mild symptoms last week. Damon's 2 siblings and parents have not been ill, and you just weighed him. He was just weighed at 30 pounds with his clothes on. The mother says that's 1 pound less than his last weight a few months ago. So, and then the recommendation would be to do his vital signs and do a head to toe and to notify the doctor. So talk to me about what are some things that you're thinking about with him right now?
Yeah. He kind of has like maybe diarrhea.
Yeah.
Like infection going on.
Yeah, I could have the flu, some sort of infection. What are some, let's look at it this way. What are some kind of red flags for you when you look at just this background stuff here?
He lost 1 pound.
Yep, lost weight.
Mm. He's becoming more lethargic.
Yes, definitely.
He would not cooperate.
Right. But that could be from his autism, right?
Yeah, and he hasn't voided for 12 hours.
Yeah, very concerning. And he had the 10 loose green stools in one day today.
Mm.
So these are all items of concern. What are you thinking the doctor's going to need to do with him? What do you think? You think he needs an IV?
Yes,
Yeah.
IV.
Yeah,
He's becoming dehydrated.
right. Right. So definitely, I would say he needs an IV. So I'm going to let's just open this next, sorry. So in the meantime, before I open the next chart, I want you to go back. What I'd like you guys to do is review these two CDC CDC important milestones for children. Okay, so you'll review those, but on second thought, I'm going to go ahead and go into the next chart, okay? Okay. So this next S-bar is at 3 o'clock in the afternoon. So that other one was 8 o'clock. And the nurse is, who's giving it is the ending shift nurse. So again, situation is Damon McAdam. He's 2.5-year-old boy admitted through the emergency department. So he's been admitted now. Yesterday for acute gastroenteritis with dehydration and unusual bruising. So you want to go ahead and Lynn, you want to read the background?
Yes. Damon McAdam was brought to the ED last night after having vomiting and diarrhea for 3 days. Child was lethargic and refusing any type of oral intake. Since admission, he has received a 250 ml bolus of lactated Ringer's solution followed by a solution of 5% dextrose in 1.5 normal saline. His IV started at 60 ml per hour and then was decreased to 20 ml per hour this morning. He refused oral fluids overnight, but this morning drank 200 ml of water and 50 ml of juice and kept it down. He's been eating graham crackers also. His last stool was around midnight and was small and liquid. He has had 3 wet diapers since 2 a.m. for a total output of 500 ml. His last specific gravity was 1.008. His last vital signs were temp 37, HR 110, respirations 28, BP 80/65. His poor skin turgor has improved and his mucous membranes are now pink and moist. Keep going.
So just in that little part, just before we go on, how do you think he's doing?
Not well.
Do you think he's doing better than when he first came in?
Yes, he's eating a little bit.
Good, yeah. So to pull out some things that make you feel better since admission, he's received 250 of the bolus of lactated Ringer solution. And now he's getting a D5.5 normal saline and he's getting IV fluid. So all of that is really good, right?
Mm-hmm.
So now at least we're reversing some of his dehydration signs and symptoms. And then what else this morning has he done that makes you feel like he's starting to feel better?
He drank 200 ml of water and
right?
juice.
And kept it down.
Mhm.
And he's been eating some graham crackers. That's all good. How many wet diapers has he had?
3.
3. And the total output is 500 mLs. How do you feel about that?
Mm,
So think about what would our expectation for a 2.5-year-old be for urine output? What do you think?
sure.
Sure. What? So did they give us a weight on him? Do you remember? Did they give us? Oh yeah, they said 30 pounds, right? So 30 pounds is how many kilos? How many kilos is that?
13.
Around 13, yeah, good. So he is considered really a toddler. So he's older than a year. Typically you want to see at least 1.5 mLs per hour per kilogram. Sorry, 1.5 mLs per kilogram per hour. So that would mean if he's, you said 15 or 13?
13.
13. So what's 13 times 1.5?
I'm gonna have to call you back.
20.
20, okay.
Yeah.
Can you please? So 20, and it's probably been, I mean, I'm guessing here because it doesn't tell us how many hours. But even if this was, if she's meant for her shift, which would have been an 8-hour shift, if he put, our expectation would be 20 times 8. We want him at least to have like around 160 mLs out, right? And he's put out 500. So does that make you feel better?
Yes.
Actually, I take that back. So since 2 o'clock, so that it's probably more 12 hours. So 12 hours times, what was your amount again? Per hour? That,
Per hour. 20.
so yeah, 20. So 20 times, it's probably, we probably should say more, 12, 0, 4, 0, 240. So having 500 out since 2 o'clock, he's good. He's not considered dehydrated anymore. And also, what other thing here makes you feel a little like he's improved?
Skin trigger and
Is-
mucous membranes.
Yes, yeah. Do you see how this is? So now they want you to know that he's starting to feel better. Now, there is something in the situation that they described that you might draw some concern now that he's getting through the dehydration. What is that?
Unusual bruising.
Yes, the unusual bruising. Now, at this point, this could go 2 different ways, right? You want to speak to the parents. You want to figure out why he has this unusual bruising, right? Because remember, this is a child that is very different from their other two children. And along with that comes learning disabilities and communication disabilities that makes it difficult for families to adjust sometimes, right? So go ahead and read this second part.
Damon is up to date on his immunizations and receives regular well-child visits. His mother is very concerned about Damon's recent development of some unusual behaviors like flapping his hand and not responding to his family members, as well as a loss of some previous language skills. She states that her husband Marshall is becoming frustrated with Damon, though she is not sure how he got the bruises on his torso. And she has not felt that her children were ever unsafe with him. The ED social worker talked with the mom briefly last night. This morning, the pediatric family social worker spent some time with her. Marshall is coming in later this afternoon to meet with the social worker. Dr. Patel is coming in this afternoon, and if dehydration is resolved, the plans to stop the IV fluids, meet with parents and social services, and probably discharge with developmental clinic follow-up and a home assessment. Dr. Patel brought up the possibility of autism with mom, and she became very upset.
Okay. Is there any questions you're thinking right now, or? So what they're faced with right now, now you're getting a team is this is called team collaboration, right? They've got a social worker there. There's going to be a nurse. The doctor will come in, and they've asked the dad to come in. All right. The doctor just now has brought up that he thinks that he is probably autistic, and the mom is upset. Now, the goal of this conference, what do you think some goals are going to be for him, for this family,
To educate about autism,
say that again?
educate them about autism, maybe.
Educate them. Okay. What about safety? What things about safety could you think about? So up here, they're talking to mom, and she states that her husband Marshall is becoming frustrated with Damon, though she is not sure how he got the bruises on his torso, and she has not felt that the children were ever unsafe with him. But so there is some concern that there's possibly some child abuse going on. Maybe just out of frustration, or maybe not. Maybe Damon is a child. Sometimes autistic kids will hit themselves against the wall. But it is concerning that he's got these bruises on his torso, right?
Yeah. Maybe
Okay.
he
He could have, but you know, that is something that as the nurse and as this team, you have to figure this out. We can't just assume, oh yeah, he just fell, and then send him home. Because that's the plan. I mean, his dehydration is resolving. He's not having diarrhea anymore. His real issue is that the family needs to, like you said, be educated as to what it means to be autistic, but also needs to be set up with someone who will actually evaluate him and see if that is actually the problem. So these are some issues that as a nurse, you're gonna need to be part of that team. Okay, so the assessment, Damon had gastroenteritis with dehydration that is resolving. He has developmental delay with a new diagnosis of possible autism, which needs to be confirmed by developmental specialist. The unusual bruises have raised the possibility of maltreatment requiring parental and home assessment. And then the recommendation is that Damon needs vital signs checked and a focused assessment for dehydration, notify Dr. Patel of the results, and continue to assess his behavior and support his parents. The meeting with Damon's parents, social worker, and Dr. Patel regarding discharge, you'll attend that with them later today. So that's the charting. We're at 3 o'clock, okay? So right here at this point, let's just take a quick look here. So he's 2.5, I think they said. So if you go to that link that I have there, you go in here and you look at this website, okay? It's from the CDC, and look at this milestone marker. So I'm gonna just click on this. They have pictures here. So 2 years, copies others, especially adults and other children, okay? So just go through this. This gives you an idea of what a 2-year-old should do, okay? Go through all of that and then go through this one. This is for a 3-year-old. And let's just use a different one.
What is this? A phone. What is this? A block. What is this? A crayon. What is this? A book. What is this? A shoe. What is this? A shirt. What is this? A scissor.
Okay, how do we, oh,
What is?
okay. So go through those two. I'd like you guys to go through those. So Lynn, I want you to understand that going through these things, and everybody who's listening to this, that these are things that can be on the exam, okay? So going through those important milestones and understanding what we're saying, what they're saying is important. All right?
Yes.
Okay, so the third part to this is the third chart. Okay, so the person providing the report is the nurse manager from Early Intervention Developmental Enrichment Program, and it's 10 o'clock in the morning. Do you feel like reading this, Lynn?
The situation?
Uh-huh.
Okay. Damon McAdam is 2 years, 8 months. We are following him as a part of the Early Intervention Developmental Enrichment Program team after a hospitalization for gastroenteritis dehydration. During that hospitalization, a report was made to Child Protective Service for possible child maltreatment. He was also noted to have developmental delays and possible autism. Although the autism diagnosis has not been confirmed, CPS has been satisfied with the visits and follow-up, and the case is now inactive. The parents are awaiting an appointment at the Pediatric Developmental Specialty Clinic. The diagnosis of autism has not been confirmed.
Okay, so good. So we've moved past that they think he's being maltreated. So CPS has basically said they're comfortable that this family is not abusing this child. So that's a hurdle that this family has moved past. So background, this is the second visit by the nursing team. Damon is the third child. Brother Jameson will be 6 next month. Sister Stella is 4. Both parents work full time. Mother has been taking half days off once a week for CPS visits, and now for the PT and OT, speech and nursing visits. Damon receives regular pediatric care with Dr. Nugent, and he is up to date on his immunizations. He has been healthy before his recent hospitalization. Damon's father, Marshall, is attending his parenting classes and reports that it has been helpful, though he is not certain he needs to continue. He is aware that his frustration with Damon's behavior caused him to respond with overly firm handling, and he believes that knowing there's a problem and learning how to manage it will be beneficial. He is also aware that we will continue to assess for bruises and injuries. Both parents are very concerned about Damon's development. He started speaking around a year old and then stopped when he was 2. He has temper tantrums and is a poor sleeper. His behaviors include rocking back and forth, screaming when approached by strangers, and not responding to his name or directions from his parents. He likes to play with puzzles and his parents' cell phones. During his hospitalization, Dr. Patel and the pediatric team brought up the possibility of autism, and they recommended follow-up with their pediatrician, Dr. Nugent, and the Pediatric Development Specialty Clinic. So you want to read the assessment and the recommendation?
Yes. Damon has a new diagnosis of developmental delays, possible autism. The family has experienced a lot of stress during these past 2 months, and it continues as they await a diagnosis for Damon. For these nursing visits, you need to do vital signs and a basic physical assessment, assess his developmental milestones, and evaluate parents' need for educational and support.
Good. So what I would think, if you're the nurse in this clinic, they would go up to something like these 2 milestone, these assessments, and they would do one of those 2 on Damon. Okay. Okay, so let's go into this one. Okay. So now this is the plan of care for the team, okay? What I just want to point out to here is just that this is how a team plan of care would look, all right? So they go back into what possible diagnosis, the medical history, that his immunizations are up to date, he's not allergic to anything, what diet he's on. And functional limitations, meaning, is he confined to a wheelchair? Is he able to walk on his own? Those would be the functional limitations, right?
Yep.
Okay, so then orders for treatment, occupational therapy or speech therapy, he's probably not talking. They said that he screams a lot. He's doesn't like strangers. So there's some things that they've given you information on. Nursing case management visits once per month for the last 3 months, and visits are scheduled pending his further diagnoses. So they write their goals for Damon, and they are going to evaluate abilities and make recommendations in the following area: his speech, his cognitive function, his social development, sensory and motor development, personal responsibility and self-care, play, behavior problems. And then evaluate parents' goals for the child and include family in Damon's plan. All right, so would you mind, Lynn? It's just Lynn, it's just us two still, huh? Yeah. Lynn, would you mind reading the nursing visit?
Yes. Damon has had 2 visits from the OT speech team. They have been obtaining history from parents and beginning speech, developmental, and behavioral evaluations on Damon. Mom, Amber, reports that Damon was developing normally until around the age of 2 years. He had a vocabulary of at least 20 words and was putting 2 words together. Sometime around the age of 2, they noted changes in his speech and his interactions. He stopped paying attention to what was happening around him and stopped speaking.
Over the period of a few months.
Sorry.
That's okay.
Where was I?
Right up here.
Okay. Sometime around the age of 2, they noted changes in his speech and his interactions. He stopped paying attention to what was happening around him and stopped speaking over the period of a few months. He became involved in just being by himself, doing things like puzzles. She also noted recent development of some strange behaviors like flapping his hands in the air. Amber sat near Damon and he calmly played with his blocks or her cell phone. He screamed when he approached him. We were able to do a basic skin assessment with mom's assistance, and there were no abnormalities noted. Vital signs, heart rate 122, respiration 24, temperature and blood pressure not assessed. Damon has no signs of illness.
So what do you think about the heart rate? Is that a little high?
Yes, it's a little high.
Is there a reason you think why it could be? I mean, it is a little on the high end, but what do you think just happened that would make him have a higher heart rate?
Because he was approached by the nurse.
Yeah, and he screamed and but he's not acting sick or anything, so you should be okay on that one. So now that you've gone through this, the last part of this is you have seen the McAdam family in these 3 snapshots in time. And now I want you to finish the story, quote unquote. Where do you envision that Damon, his parents and siblings will be in 3 months? Based on what you know about the McAdam family and the challenges they're dealing with. So well, how this is going to go is I would think you should go back up and review these milestone area and really look at your readings on autism and in Cooper and Gosnell, review those and come up with where you think this family is going to be in 3 months. All right. So, and I do want where you're finding the data cited. So my suggestions would be Cooper and Gosnell, your ATI books, and just maybe the, you can go on, like there is, well, the CDC website, I'm sure the APA or the American Psychological, I'm sure they have some stuff. But if you go on websites, they have to be reputable websites, okay? So remember, this is, oh, and then the last part of this, and I didn't, the last part of this, Lynn, is to relate your own beliefs about the role of a nurse in continued care and any resources and referrals that you might think this family would benefit from. So really, really think about how you would react to this family and to taking care of this child. All right. So this is worth 5 points, this whole assignment. So I would think, you know, obviously I think this part is going to be the harder part. Take you a little more time. Okay.
Yep.
Okay.
And you want it in paragraph, or we can just like list the stuff?
What do you mean? I think a paragraph, or I could see you could do a care map, or you know, a concept, or probably a care map would be more like it, with Damon in the middle. And then make some sort of concept map or care map from that. So it's kind of your choice.
Okay.
Okay. I probably should put that in here, huh?
Yes.
Where should I put it? Relates. No, maybe I'll do it like this. I think I'll put it up in here, okay? And I'll put this assignment can be, let's see, questions part 1. I'll put it in here in capitals, or form, or this assignment can be done in a paragraph form, or as a or care map. How's that? Does that make sense?
Yes.
Yeah, because I don't know how I would put. That won't let me do that. So let's see. Well, actually, this one, part 1 questions are you're just gonna answer those, I think. And then do this. Okay. All right. So I think that was pretty much what I wanted to go over for you. Is there anything else that you want to go over?
Not really, Miss Thorpe. Just like for the exam, when we'll be able to see it, like
When will you be able to see it?
the results.
You know what, Lynn, I have to grade your, so have you even gotten to see any, let me see here. Have you even gotten to see your grade? Because I have not looked at it I have not looked at it to grade your essays.
Oh, okay.
Okay, let me see. Let me turn this off.